What's up, guys? Welcome back to... Hold on. Do you hear that? What's up, guys? Welcome back to Patho and Chill. I hope you're having a great day. Today, we're going to be talking about chronic valve disease. Now, before we get started, I want to make it clear that we're going to talk about two different types of chronic valve disease. First, we're going to talk about degenerative valve disease, and then we're going to talk about rheumatic heart disease that leads to valvular disease. Okay, so starting off with degenerative valve disease. So this is most commonly occurred in adults, which makes sense because as you basically go on with life and you age, your tissues start to become weaker, from that constant, the heart never stops pumping. So it makes sense that the tissues would start becoming weaker and thus lead to potential problems with your valves. So this is also this is also multifactorial, meaning that genetics can play into it. There are multiple diseases out there that can increase the likelihood of such a valvular disease occurring on you, such as Ehlers-Danlos syndrome or Marfan, which all include basically connective tissue disorders. So basically that collagen or elastic fibers that make up the valves are weaker and so are more likely to become damaged. So let's talk about mitral valve prolapse. So what exactly is prolapse? Prolapse is basically, so you have your valve is normally sitting like this, right? And so whenever the valve starts to become prolapse, they start to thicken. And as they thicken, they start to push up against each other, right? And so then they start to bulge up into the atria where they're not supposed to be. And basically, as they become tighter, it makes it harder for the blood to shunt from the atria into the ventricles. Now, whenever you have a prolapse valve, it can be the number one leading cause of a mitral regurgitation. And so the regurgitation basically happens once the prolapse is no longer touching each other, right? So they've bulged up enough to where now they're leaving a space between each other. And so basically the atria will pump the blood down into the ventricles. And then when the ventricles squeeze, a little bit of that blood will be shunted back up into the atria. And so this is basically bad for you because that increased volume of blood back into the atria. So now whenever the atria has to squeeze, it's having to deal with more blood than it normally used to. And so this greater volume of blood is basically an increased pressure. And so whenever it has to deal with more pressure, the heart starts to get more tired, and that can lead to potential heart failure. So lastly, mitral valve prolapse occurs in about 2.4% of the population, which is a pretty significant amount in the grand scheme of things. Moving on, still within that degenerative valve disease kind of subcategory, we're going to go into aortic fibrocalcific disease. So what is exactly happening? There are depositions of fibrocalcific nodules on that aortic valve that basically decrease the amount of blood being shunted. And so if we can kind of picture the head of a shower, right? So whenever the pressure of the water starts to decrease, it kind of sucks. You have to get closer into the wall to get any water. And so this is basically happening because there are minerals that are being deposited, right, that are preventing as much water basically coming out from your shower head, which is exactly what's happening in the heart. So because of these nodules that are depositing on the valve, whenever the ventricles squeeze, now the valves are closer together. So the stenosis, right, there's a narrowing of the passageway for the blood to move through the aorta, which is going to obviously lead to decreased blood to your systemic circulation. Now, this is even furthermore increased, the potential of this is furthermore increased whenever you are born with a bicuspid aortic valve. So normally that aortic valve is made up of 3 leaflets, but sometimes children are born with 2 of these leaflets fused together, and then once these calcific deposits start to occur, it only makes sense why it's going to make it even harder or more likely for that aortic valve stenosis to occur. So now let's move on to that second part of the chronic valve disease that I mentioned earlier, which is the rheumatic heart disease. So this is basically caused as a complication from a group A strep pharyngitis infection that can lead to the hearts, right? So this is the complication. And so basically this is going to generate rheumatic fever. And so this rheumatic fever leads to chronic inflammation around the heart. And so the heart is going to naturally want to repair itself from all this prolonged inflammation. And so as the inflammation continues, the heart's going to start placing down scar tissue, and this scar tissue is going to basically lead to fibrosis. So whenever there's too much scar tissue, that's not actual heart tissue, right? It's not myocardium, and so it can't actually contract. And so basically, if this happens in the valve, then the valves are not going to be able to move as open as efficiently as they once did. So then this leads to what the most common type would be mitral stenosis, right? So the valve that exists between your left atria and your left ventricle. So while this can happen to adults, it is most commonly seen in children. So I just kind of wanted to leave off with that final fact before signing off. So as always, if you enjoyed this video, please make sure you hit the like button down below, hit the subscribe, check out my other videos. And as always, I hope you're having a chill day. I will see you next video, and peace out.